So in today's session, we're going to look at top line lower urinary tract health in both dogs and cats. We'll mostly be talking about the lower urinary tract within this presentation. So just as a reminder, here is a simplified version of the urinary system. The upper urinary tract consists of the kidneys and the ureters, and the lower urinary tract is the bladder and the urethra. The urethra is not shown within this diagram. Some conditions affect both the upper and the lower urinary tract. For example, uroliths can be in the bladder or the urethra, or in the kidney or the ureters. It is important to image the upper urinary tract to check for any uroliths, even if the animal is only presenting with lower urinary tract signs, as there still could be stones within both locations. Discussion of renal disease in nutrition can be found in another presentation on our Purina NF product. Okay, so now we're going to look at canine urinary conditions. If we look at the split of canine urinary conditions, what you can see from this chart is that bacterial cystitis forms the majority of cases, followed by urinary incontinence. Urinary incontinence is particularly common in females, and we're going to move on to uroliths in the next slide. Okay, so canine uroliths. So here we're dividing them into two groups. So you've got struvite and calcium oxalate, which make up the vast majority of cases. We have other stone types, for example, urate, calcium phosphate and cysteine, but these are much less common. Over 80% of canine uroliths are struvite, and this is because struvite is associated with the presence of bacterial urinary tract infection. Struvite is otherwise known as magnesium ammonium phosphate. This full name gives you a clue as to this stone's types, components or building blocks. Calcium oxalate is also quite common in dogs, particularly in the upper urinary tract of smaller males, but overall is less common than struvite. Sometimes it is found in mixed or compound stones, where the calcium oxalate is the original stone, and then due to a trauma of the bladder, there can be a secondary urinary tract infection, which then changes the urinary environment. And that's when you get these layers of struvite around the calcium oxalate core, which is sometimes referred to as a nidus. So when you see the urolith in the upper urinary tract, so the kidneys or the ureters, it's much more likely that it will be calcium oxalate. Rarer uroliths include urate, several forms of calcium phosphate and cysteine, and we'll come on to some of those shortly. Looking at the pictures below of some typical struvite and calcium oxalate stones now, you can see that the struvite stones tend to be larger and often have smoother, flatter surfaces. They sometimes fit together like a jigsaw puzzle. Struvite is most commonly and easily recognisable as a crystal with a coffin lid appearance. On the other hand, when you look at calcium oxalate stones, these tend to be smaller and irregular or spiky. Their shape tends to make them more irritating, so they'll often be associated with blood clots and severe cystitis. The crystals in the images are calcium oxalate dihydrate, and these have a typical envelope appearance. Okay, so now we're going to think about why do uroliths form. So this is a really important concept that I want to raise you, which is one of saturation of the urine. So saturation of the urine with the urolith building blocks is an important concept. So I like to use a bit of an analogy for this one, and we'll use the cup of tea analogy, which we'll come on to shortly. But for example, this is when you've got more of those building blocks. So in the example of struvite, I talked about magnesium, ammonium and phosphate, and you've got more of those versus the volume of urine. Okay, so let's go on to our analogy for saturation. So the cup on the left hand side is undersaturated. So if I had a cup of tea and I added 1 sugar to it, my tea to sugar ratio is undersaturated. Whereas if I had the same cup of tea and added 7 sugars to it, my tea to sugar ratio is oversaturated. So I've got a lot more sugar than I have the volume of tea. So if we now take that principle and apply that to the analogy of urine, an oversaturated urine will have more of the building blocks of the crystal type to the volume of urine that's in the bladder. And when we're aiming to dissolve a struvite stone using diet, we are aiming for an undersaturation for that mineral type. Okay, next we're going to have a look at urinalysis. So remember that some crystals are normal. Struvite crystals are very common finding, so be careful not to over-interpret their presence, especially in a dog without a urinary tract infection. However, if you have an animal that also looks to have a urinary tract infection, then the struvite is more significant. We've already spoken about the other factors involved in urolith formation, and animals with crystals will not necessarily form stones. However, in animals with a history of uroliths, monitoring for crystals can be really useful, as well as keeping an eye out for other important factors that increase the risk of stone reoccurrence. So, for example, pH, urine-specific gravity, or the presence of infections. So just want to take this a moment to point out that we have some really informative urinary help sheets that can be shared with practices, and these are designed to help you understand how you can manage uroliths within practice, but also to support you from understanding kind of the urinary stone or crystal, and then how the dietary management will be managed. So let's move on to look at struvite in a bit more depth. So firstly, struvite stone formation in dogs is usually induced by urease-producing bacterial urinary tract infections. Unlike in cats, struvite without infection is very uncommon. If you suspect the presence of a urinary tract infection, you need to treat that underlying infection. Ideally, we need to be looking at culture and sensitivity of the urine obtained by cystocentesis. Struvite stones are much more common in females because they are more prone to those urinary tract infections. A urinary tract infection that's caused by urease-producing bacteria organism is usually required for struvite to form in dogs. Second, we need to think about dissolution. So dissolution should be attempted in almost all cases. The exceptions include if medications or foods are contraindicated. The urolith cannot be bathed in modified urine. So for example, if there was an obstruction or a very large stone occupying almost all of the bladder, or if there is an uncontrollable infection despite appropriate management and compliance. We know that most struvite stones that cause a urethral obstruction can be dissolved following retropulsion. Retropulsion is the term used for when the stone is pushed back into the bladder. Struvite is more soluble in an acidic urine, and the substrates in struvite, as we've already mentioned, are magnesium, ammonium, and phosphate. The vast majority of cases of struvite uroliths in dogs are infection-induced. Antibiotic treatments for the duration of dissolution is a key part of the management, not an optional extra. So we are aiming to acidify the urine, minimise the substrate availability, so those building blocks of the type of stones that it is, reduce our urine-specific gravity, so we've got a more dilute urine. We want to continue to do radiographs and urinalysis, including cultures, at least every 4 weeks during the dissolution stage, and then we will continue the dissolution diet for at least 4 weeks after the stone has dissolved. We want to then look at preventing that reoccurrence, and this is where we're going to be continuing to monitor them. So this is where, after successful dissolution, you will be looking at confirming that with imaging, and then creating and implementing a plan for the ongoing monitoring for that dog. So we're going to be looking at long-term monitoring for urinary tract infections. We're looking at maybe urinalysis and culture after 2 weeks, again after 4 weeks, and then again after 3 months. We need to also address any potential predisposing factors that are there and relevant for that dog as well. Okay, so now let's go through some of the specifics of our UR diet. So UR can be used to dissolve struvite, but it's important to note that calcium phosphate stones cannot be dissolved, so struvite is needed when indicated. We will go into the 3 key benefits of this diet in the upcoming slide. In addition to the diet being the diet of choice for struvite dissolution, UR contains a variety of useful ingredients to support bladder health. So we have a source of GAGs, which is glycosaminoglycans, which are an important component of the protector bladder lining. We've got those omega-3 fatty acids to support the natural anti-inflammatory processes, and we've got antioxidants to minimise the oxidative stress. Okay, so let's have a look at the 3 benefits of the canine UR. The first of these benefits is that it's been designed to produce a more acidic urine. Our target is a urine of 6, and that will create an environment to dissolve those struvite crystals. UR contains urine acidifying substances such as calcium sulfate to bring the pH down and to help dissolve the struvite. The second benefit of our UR diet, if you remember back to the #1 cause of urinary issues for dogs, it was infection. So having a diet that has moderate protein levels means that there is less of this urease producing bacteria being released. And therefore that then helps to keep the infection under control. The last benefit is this diet is suitable for long-term feeding for those that are getting reoccurring infections. So we know that for some of these animals, they will have those bounce back infections, and for those animals, they will need to be on the diet long-term. And that's why palatability is so important, because that helps with owner compliance and maintaining that kind of human-animal bond that they get out of feeding and seeing that the animal is satisfied. So now we're going to look at the management of calcium oxalate in dogs. So this can't be dissolved and is highly reoccurrent. I think the statistic is about 50% will reoccur within 2 years. Any stones need to be removed if they've been indicated. Although they're generally smaller than struvite, calcium oxalate tend to be spikier and therefore more irritating. We suggest that you image every 6 months to allow removal of small stones via less invasive means. So when we look at nutritional management for calcium oxalate stones in dogs, we've already said that we do need to look at surgical removal first. We are then looking to aim for a dilute and neutral urine with the absence of calcium oxalate crystals. Ideally, we are looking for a urine-specific gravity of around 1.020 and a neutral pH between 6.7 and 7.5. We want to look at urinalysis after 4 weeks and then after every 3 months after that. So when we're looking at the nutritional management, what also do we need to consider? So we want to avoid high protein because animal proteins increase the acidity of the urine. We want to lower the protein to encourage them to empty their bladder. We want to be cautious with any supplements or treats that might be high in calcium. So for example, milk or cheese. Look at supplements such as cranberry, vitamin C and vitamin D, and avoiding foods that are high in oxalate. So for example, your nuts and your leafy greens. Okay, so let's now have a look at urate. So there are 2 main reasons why you see urate in dogs. It is either a genetic predisposition, which is often seen in Dalmatians, or an issue with the liver, such as a shunt or a liver disease. So when we look at the common cause of this, it's about an inefficient transport of uric acid into the liver cells for conversion into the water-soluble allotonin. Urate urolithitis is rare in female Dalmatians. Now meat, especially organ meat, is very high in purines, and we are looking for a low purine food that has ideally been formulated with things like egg, dairy or vegetable proteins, which will result in a more neutral or alkaline urinary pH. It's important as well to think about medical dissolution of stones using something called allopurinol, because that may be possible in some genetically linked cases, for example, your Dalmatians, but it won't be suitable for those that have an underlying liver disorder. Animals that are being given allopurinol should also be fed a purine-restricted diet to reduce the risk of xanthine crystals and urolithiasis. From a monitoring point to view, we want to continue to perform urinalysis every 3 months to ensure that the urine is neutral to alkaline and dilute as necessary. And we want to do imaging every 6 months to detect any small stones and then take appropriate action. So now let's look at cystine stones in dogs. So cystine is often seen in male entire dogs, and for some it is hormone responsive. So castration is normally the first recommendation. In order to reduce the risk of reoccurrence, you would then look at increasing their water intake, diluting the urine so that it's a more neutral or alkaline pH, and avoiding diets that are high in protein. Okay, so now we're going to move on to our feline friends. So we're going to have a look at feline lower urinary tract disease, or FLUTD, as it is commonly known. And this is a collection of symptoms that can be a result of different diseases. One thing to note is that most FLUTD cases are due to feline idiopathic cystitis, which is FIC, inflammation of the urinary tract of an unknown cause, followed by urolithiasis and urethral plugs, and then other causes such as urinary infections are very uncommon. Now, when we look at feline idiopathic cystitis, it is inflammation of an unknown cause, and it's the most common cause in cats, impacting about 60 to 70% of all urinary issues. The next is urolithiasis, which is between 10 to 30%, struvite being the most common, followed by calcium oxalate. Then we have urethral plugs, and there is an overlap with these FIC and urolithiasis, as the plugs will be a combination of debris from these materials, inflammatory cells, blood, crystals, and small stones. And then bacterial infections, it's very rare in your adult cats, not so rare in your geriatric cats, unless there is a kind of predisposing cause such as diabetes or kidney disease. And then the last factor for cats is others. So that's things like a tumour or a change in kind of physiological form. So when we look at FIC, the most important thing is the idiopathic part. Idiopathic means we don't know. So it is an inflammation of the urinary tract system from an unknown cause. We know that these cats have really highly concentrated urine and have a very good ability to concentrate their urine. And we know that this is something that can normally resolve in 5 to 10 days, but it is very painful. And for cats, especially males, it can lead to urethral obstruction. So when it comes to the management of feline idiopathic cystitis, there is not a one-size-fits-all approach, as it will depend on what the triggers are for that cat, and often will involve a multiple approach of strategies, which is often referred to as a multimodal approach. ISFM have an excellent owner-friendly resources. If you were to Google idiopathic cystitis iCat care, you will get a really nice resource from an owner's perspective. Don't forget, we also have our fact sheets like we talked about for dog. We've also got the same, but for cats, taking through the major issues that cats have from a urinary tract health point of view. So when we look at what are our nutritional aims for the management of feline idiopathic cystitis, most importantly is to increase the water intake to try and promote a more dilute urine. The vet diets contain omega-3 fatty acids as a natural anti-inflammatory. You've got those GAGs, which is the glucosaminoglycans, which are helping the bladder lining, and you've got salt to promote drinking. RUR has been specifically designed to support cats with FIC and has all of those features, and we're going to talk about those in more detail once we've covered uroliths. So the next area we're going to focus on is urethral obstruction. Firstly, and most importantly, this is an emergency situation. It is more common in males, and I always explain it using a bit of an analogy. So imagine the urinary tract is a bit like a road. So imagine if you needed to get an articulated lorry from A to B. The male urethra is the equivalent of trying to get that lorry down lots of winding B roads, whereas the female urethra is the equivalent of getting that lorry down a long motorway. So it's nice, straight, wide road, and there's no issues getting it down at all. this is why you often see more challenges in males, because they have those long windy tubes, and it can be much harder, and they're more likely to cause that blockage. It can also cause issues to the kidneys, as the backup of urine will then put pressure on the kidneys, and this is where you can see further issues. Okay, so we know that for cats, struvite and calcium oxalate represent about 90% of the uroliths we see in cats. So conveniently, our UR diet is the diet of choice for both of these crystal and stone types. We're not going to discuss cat urate stones in this deck, as they are so rare. We've got our NF early care and advanced care cans that can also be appropriate for reducing the risk of calcium oxalate, but the UR is the preferred diet unless NF is indicated for another reason. So for example, if you had a cat with chronic kidney disease, but we've not included it in this presentation just so that we don't cause any confusion. One thing I just want to pull your attention to is one of our resources within the Purina Institute Handbook for Canine and Feline Clinical Nutrition. This includes a really nice flow chart which gives you an overview of the diagnosis and management for both struvite and calcium oxalate. If you don't already have a digital copy of this handbook, please register with the Purina Institute and you will get a free digital download. Okay, so now when we look at the management of struvite for cats, unlike dogs, it's rarely infection induced. It's more likely to be infection induced if it's an older cat. And we're looking to get an acidic dilute urine, low in the struvite building blocks, which can be achieved through feeding a veterinary diet specifically designed for struvite dissolution, such as the UR, and increasing the water intake, which we will cover shortly. Radiographs, urinalysis and cultures every 4 weeks during dissolution, and then looking at long-term monitoring. So urinalysis 4 weeks after dissolution and then every 3 months after that, aiming for that dilute, mildly acidic urine and an absence of struvite crystals. Ideally, we're looking at a urine-specific gravity of less than 1.030, and we would like to image every 6 months. So now let's look at urethral plugs. So these are often associated with struvite, and there's an overlap as well with feline idiopathic cystitis, as it will be a combination of potentially struvite, inflammation, debris, blood clots that are associated, and as a result of that inflammation within the bladder, that are then creating that suitable formation for the plug. Okay, so when we look at calcium oxalate, having small amounts of calcium oxalate in the urine could be normal if that urine is more concentrated, or maybe if it's an older sample. And diet cannot dissolve calcium oxalate, but it can reduce the reoccurrence of new crystals and stones. So our priorities when we look at the management for calcium oxalate are to increase the fluid intake. We want to avoid magnesium restriction, as this is a natural inhibitor of calcium oxalate stones. And we need to feed a diet with a low relative supersaturation, which is that more dilute environment. It's also beneficial to check for hypercalcemia, which is high levels of calcium in the blood. If you have any technical, tricky cases from a urinary perspective, please feel free to send the history and all of the information about the case through to us on our technical helpline, which is vettechline@purina.nestle.com. So if you have any tricky urinary cases or any other cases that you would like support with, please email us on vettechline@purina.nestle.com. Okay, so one important strategy, as I mentioned earlier, when we think about managing urinary issues in cats is their hydration. So we know that adult cats are not designed to be efficient drinkers because they cannot create suction with their tongues. So when they lap a bowl of water, only 3/100ths of a teaspoon of water is consumed with each flick of the tongue. Essentially, it's a lot of hard work for very little reward. So our Hydrocare product has been created to help cats consume on average 50% more water every day than with just water alone. That in turn will help to increase urine dilution, and that then helps to make their urine more dilute and helps to support their urine specific gravity. Because it's this great tasty jelly, the cats will happily lick it up, and it's a soft textured jelly as well. So we say it should be its own third bowl. So we have their normal food, their normal water, and then the third bowl, which is the Hydrocare. So we also have a really nice fact sheet on the strategies to increase fluid intake in cats, which will take you through things like using Hydrocare, wet food, looking at different types of water, so kind of sourced from different locations, maybe water fountains. Looking at different types of water bowls, how many litter trays do they have in the house, what are the locations of the food and water in relation to the litter tray and things like that. So again, please use our technical helpline address if you would like a copy of that strategies information leaflet. Now, I just want to pull your attention to a new tool that we've launched, because we know that sometimes, particularly for owners who have had issues with their cat with urinary, how much water the cat is drinking can sometimes be a challenge for them. So we've actually just launched our tailored water calculator. And what it does is it works through really nicely with you put in some kind of basic information about the cat and what it's eating each day, and it will then kind of populate how much it recommends that cat should be drinking of water on top of the food that it's having. So it's quite a nice tool, and it's a really good starter for 10 for owners that are worried their cats aren't drinking enough. So now let's have a look at our feline urinary diet. So this is the diet we would be using for feline idiopathic cystitis and your struvite and calcium oxalate. Because these are the ones that are responsible for most of the issues that are under the brackets of feline low urinary tract disease. So Purina's unique STOX urinary security is on a wide range of our diets. And that means that they've got low relative supersaturation for both struvite and calcium oxalate, which means that that's going to create an environment where neither struvite nor oxalate crystals would form. So we've got the three main benefits of this product, and I'm going to cover that in the coming slide. So the first benefit is low relative supersaturation. So the UR is creating a more dilute urine with a lower urinary specific gravity and a larger volume of urine to create that low relative supersaturation, which helps to produce a urine composition that promotes the dissolution of struvite crystals. Secondly, it creates a urinary pH that will dissolve struvite of between 6 and 6.3. So it has been proven that it will start to dissolve the struvite within 3 weeks. And lastly, we know that being overweight is a major risk factor, and therefore the UR contains moderate calories to try and support these cats with that. Some of the additional benefits of the feline UR are the reduced urinary mineral concentration, the combination of both wet and dry to support hydration and water intake in cats, but also that personal preference from a texture point of view for their food. We've got natural sources of our glucosaminoglycans or GAGs to support the mucosal layer of the bladder, and we've got our omega-3s to support from a natural anti-inflammatory process. Thank you so much for taking the time to listen to this presentation. If you have any questions, please reach out to us on vettechline@purina.nestle.com. Thank you so much.